Cerebellum, located at the back of the brain, it controls coordination, balance, and fine motor movements. It ensures smooth and precise physical actions. Damage can cause tremors, poor coordination, and difficulty walking, affecting daily activities and overall motor function. Cerebrum, the largest brain part, responsible for thinking, memory, voluntary movements, and emotions. It is divided into left and right hemispheres, each controlling opposite body sides. Damage can cause cognitive impairment, movement issues, or emotional disturbances, affecting overall brain function and behavior. Encephalopathy, a broad term for brain dysfunction caused by infections, toxins, or reduced oxygen supply. Symptoms include confusion, memory loss, altered consciousness, and poor coordination. Conditions like liver disease, infections, or brain trauma can lead to encephalopathy, requiring medical intervention to manage symptoms. Medulla, the lower brainstem region responsible for controlling vital functions like breathing, heart rate, and blood pressure. It connects the brain to the spinal cord. Damage to the medulla can be life-threatening, leading to respiratory failure, irregular heartbeat, or loss of consciousness. Myelin, a fatty substance surrounding nerve fibers. Myelin acts as insulation to speed up nerve signal transmission. It is essential for normal brain and spinal cord function. Damage to myelin, such as in multiple sclerosis, can lead to muscle weakness, vision problems, and impaired movement. Dementia, a progressive decline in cognitive function affecting memory, reasoning, and problem solving. Common causes include Alzheimer's disease and vascular dementia. Symptoms worsen over time, leading to difficulty in performing daily tasks, confusion, language problems, and changes in personality or behavior. Stroke, a medical emergency caused by reduced blood flow to the brain due to a blocked or ruptured vessel. Symptoms include paralysis, slurred speech, vision loss, and confusion. Immediate treatment is crucial to prevent permanent brain damage, disability, or even death. Coma, a deep, prolonged, unconscious state caused by brain injury, stroke, infection, or metabolic imbalance. Patients do not respond to stimuli and require medical support. Recovery depends on the cause and severity, with some regaining consciousness while others remain in a vegetative state. Concussion, a mild traumatic brain injury caused by a sudden impact, shaking, or blow to the head. Symptoms include headache, dizziness, confusion, nausea, and memory loss. While usually temporary, repeated concussions can lead to long-term brain damage or chronic traumatic encephalopathy. Epilepsy, a neurological disorder causing recurrent seizures due to abnormal electrical brain activity. Seizures vary in severity and type, affecting movement, sensation, and consciousness. Causes include genetics, brain injury, or infections. Treatment involves medication or surgery to manage seizure frequency and intensity. Meningitis, inflammation of the protective membranes around the brain and spinal cord, caused by bacterial, viral, or fungal infections. Symptoms include fever, headache, stiff neck, nausea, and sensitivity to light. Bacterial meningitis is life-threatening and requires immediate antibiotic treatment to prevent complications. Paraplegia, paralysis affecting the lower body and legs, often caused by spinal cord injury, stroke, or neurological diseases. Patients lose motor and sensory function below the affected level, requiring rehabilitation, assistive devices, or physical therapy to regain some independence in daily activities. Syncope, temporary loss of consciousness, fainting caused by reduced blood flow to the brain. It results from sudden drops in blood pressure, dehydration, heart conditions, or nervous system disorders. While often harmless, frequent episodes may indicate an underlying medical issue requiring evaluation. Tomography, a medical imaging technique that produces detailed cross-sectional body images using X-rays, ultrasound, or MRI. It helps diagnose tumors, fractures, and internal injuries by providing a clearer view of tissues and organs. CT scans and PET scans are common tomography types. Electroencephalography, a diagnostic test that records the brain's electrical activity using electrodes placed on the scalp. It is used to diagnose epilepsy, sleep disorders, and brain injuries. The test detects abnormal brain waves, helping doctors determine neurological conditions affecting brain function. Myelography, a specialized imaging technique that uses contrast dye and X-rays to examine the spinal cord, nerve roots, and surrounding structures. It helps diagnose conditions like spinal stenosis, tumors, or herniated discs. Patients may experience headaches or discomfort after the procedure. Magnetic refers to magnetic resonance imaging, MRI, which uses strong magnetic fields and radio waves to create high-resolution images of internal organs, tissues, and the brain. MRI is commonly used for diagnosing tumors, brain disorders, joint injuries, and spinal cord abnormalities. Positron refers to positron emission tomography, P, an imaging technique that detects metabolic activity in tissues using radioactive tracers. PET scans help diagnose cancers, brain disorders, and heart diseases by identifying abnormal cell function, often before structural changes appear. Shingles, a painful viral infection caused by the varicella zoster virus, the same virus that causes chickenpox. It leads to a blistering rash along nerve pathways, accompanied by burning pain. It primarily affects older adults or those with weakened immune systems. Lumbar puncture, a medical procedure where a needle is inserted into the lower spine to collect cerebrospinal fluid for diagnosing infections, bleeding, or neurological conditions. It helps detect meningitis, multiple sclerosis, or brain hemorrhages. The procedure may cause temporary headaches. Cerebrovascular accident, also called a stroke, it occurs when blood flow to the brain is disrupted due to a clot or rupture. Symptoms include paralysis, speech impairment, and vision problems. Immediate medical intervention is crucial to minimize brain damage and improve recovery. P stands for positron emission tomography, a diagnostic imaging technique that measures metabolic activity using radioactive tracers. It helps detect cancer, brain disorders, and heart disease by highlighting abnormal tissue function, often before structural abnormalities become visible on other scans. Alzheimer, a progressive neurodegenerative disease causing memory loss, confusion, and cognitive decline. It results from abnormal protein buildup in the brain, leading to nerve cell death. Symptoms worsen over time, affecting daily activities. There is no cure, but treatments help manage symptoms.